Hi, I'm your host, Marsha Florence for Just Dance. Today's show, ladies and gentlemen, is Medicare Made Simple. Hurry back and join us. Hi, I'm your host, Marsha Florence for Just Dance. Today's show, ladies and gentlemen, is Medicare Made Simple. And we have the advisor herself, Sharon Gray of Gray Insurance Advisors. Good afternoon, Sharon Gray.
Good afternoon. It's so good to be here.
Thank you so much for joining me.
Oh, yes. Thank you for inviting me. This is wonderful.
All right. Now, Sharon, people always have a lot of questions. Okay, and so we ask you to come and join us today to, give us some insight on how Medicare can be made simple. A lot of people are like, oh man, do I have to wait till I turn 65? And when I turn 65, what does that mean? So tell us a little bit about yourself and your role as the advisor.
Okay. Well, I started this about 5 years ago, started talking to people about Medicare, and it was because I had lost my job because of COVID. And during COVID, I used to enroll people into Medicaid when I worked for a clinic, and I enjoyed it. And so during COVID, when I lost my job, I'm thinking, what am I going to do? And my husband, he was a Medicare agent, and he said, you could do what I'm doing. And I said, yeah, I was pretty good at that. So I started studying. I had to get my state license first, and then I had to get certified with Medicare, and then I had to get contracted with different carriers. So that's what I was working on during COVID. And then after that is when I just started talking to people, enrolling people, helping them, and I have absolutely loved it because I have found that it is a much needed service. I did not realize how overwhelming Medicare can be and how confusing it is until I started talking to people and just hearing the questions, and people are misinformed. And so I'm just happy to be able to serve my community and just get the record straight about how Medicare works.
That's great. That's great. Well said. Well said. Now, the famous question is, everybody always asks, when do I apply for Medicare?
Yes, that's a question I get all the time. When? So when you're turning 65, that is when you do have to start thinking about Medicare. It is 3 months before your birthday and the month of your birthday, and then 3 months after your birthday. So you have a 7-month window to apply for Medicare. But the question is, do you need to apply? Because if you are working and you have employer coverage, you are able to delay your Medicare. And that means you just don't do anything.
Okay.
Some people will say, well, what do I have to do? Do I have to call them? No, you just don't apply. You don't do anything.
So you don't get penalized?
You don't get penalized as long as you have credible coverage.
Okay.
And most people, if you're working for an employer that has 20 or more employees, you have credible coverage. But if you're working for an employer that has under that amount, then you will have to apply for Medicare. So it just depends on who you work for and what their coverage is like.
What do they really mean by being penalized, though, if you miss that period? What does that really mean?
Well, what that means is that you will be assessed an amount of money that you have to pay. It comes out of your Social Security and is there forever. So you can get penalized. Let's say you never applied for Medicare and you're outside of the 7-month window. Now it's 9 months later and you're thinking, well, I just didn't do anything. I thought they were just gonna send it to me. Now I have to apply. Well, now you're outside of the 7-month window. They're gonna tell you what your penalty is for not having your Medicare when you turn 65.
Wow. You know what? And well, I'm not gonna say how old I am, but okay, got that, got that. No, so now what about the individuals who sustain a disability, a car accident or something like that, and they are in Medicare? Do they have to re-enroll, or are they already in that?
No, they're already in Medicare.
Okay.
And usually when you're on disability for 24 months, they automatically put you in Medicare.
Okay.
And so then when you turn 65 and you're already in that situation, it just keeps going.
Okay, okay. Because I'm trying to figure out, you say enroll and a person sustains an injury, and then all of a sudden they have received Medicare, and they said, well, do I, contact somebody? I'm not 65 yet, but I will be. Is this a different kind of Medicare? But this is all inclusive.
It is, but not to make things too confusing. It's just when they turn 65, when you turn 65, you can choose whether you want Medicare Advantage or if you want Medicare Supplement. And
now,
see, that's a whole different.
You know I'm gonna ask what's the difference, because somebody at home saying, well, what's the difference?
Right.
So you're gonna fill us in?
I'm gonna fill you in. Medicare Advantage is it's all by private insurance companies, whether you get Medicare Supplement or Medicare Advantage. Medicare Advantage is the Part C that you hear about all the time. And then Medicare Supplement is Medigap. Medicare Advantage, the big difference is that you don't pay anything per month for it, but you pay copays. The Medigap, you pay per month for that, but you don't have all the copays to go with it. So I have to explain the difference to people because, of course, you won't know. But when you turn 65 and you are already on Medicare because of disability, then that opens a window for you to go to a Medigap plan if that's what you want to do.
Okay.
Yeah.
So the Medicap is you're paying a monthly premium, but you don't pay copay.
Right.
Now, does the monthly premium fluctuate?
It increases over time.
Well, who wants to do that?
I
Okay,
know.
I'm just kidding. Some people, like you said, somebody might not notice it, and, and they already have it. Okay.
Right.
And they don't want to pay copays because copays are a pain.
Yes,
So every year around the same time, you get nervous when it's like, renewal time. You're like, I gotta finish paying a copay. Is that where that premium amount is always locked in? Like they say you got to pay X amount of dollars before the copays go away, or?
Oh no, that's a deductible.
Deductible. Okay.
That's a deductible.
Okay.
So if your plan has a deductible, let's say it's $1,000, that means you pay the first $1,000 and then your plan kicks in.
Okay.
So deductible means you pay first, then they'll pay. So the best thing to do is get on a plan that does not have a deductible.
And keep the copay.
And that's easy to do.
And
That's
keep
easy
the
to
copay.
do.
Okay. Well, I tell you what, Sharon, we're going to take a small break. And ladies and gentlemen, we'll be right back with some more good information about Medicare Made Simple. We'll be right back.
I try to keep up with what these young people is doing and knowing.
I was at work and I just got a text from a number that I didn't know.
I sent him a text. He texts me back and say, "Who dis?" And I just thought that was the funniest thing.
The next few weeks, she just made fun of me, like would answer the door and say, "Who dis?"
Who dis?
Drop off a warm meal and get more than you expect. Volunteer at americaletsdolunch.org.
America, let's do lunch.
And welcome back. Now, ladies and gentlemen, you know me, I always tell you get your pen and paper out, because why? Everybody you see here has some juicy information to give you. So a lot of you are concerned about turning 65 and not being prepared to know what to do about having your Medicare coverage. And Sharon Gray of Gray Insurance Advisors is here today with us to give us some insight so that it'll make your transition on that method smooth. Okay? All right, so Sharon, I had to say that because, when viewers are clued in, I don't know if they're sitting like this, and, or they say, I hope she asked this kind of question.
Right.
So the question I want to start with is that, what is do people have to apply for Medicare at the same time they get Social Security when they turn 65?
They don't have to. No, that depends. So I am also a RSSA, which is called a Registered Social Security Analyst. That means I help people with their Social Security too, so I had to get certified with that. Okay. Well, with Social Security, you do have a choice to start it at 62, or you can wait all the way to 70. It's up to you on when you decide. But when you turn 65, the Medicare, if you're not working and you have credible coverage already, that is not a choice. You do have to apply for Medicare. But when you do, they're going to ask, would you also like your Social Security? You just tell them no.
Okay. So you don't have to take your Social Security just because you take your Medicare.
Right.
Okay.
Right. They both go through the Social Security Administration, but they're two different things.
But they don't explain that in the Social Security. I mean, I'm not going to say they don't explain it, but I think people are not grasping it the same. Like they think they automatically, when they go to the Social Security office, that I better go ahead and apply for Medicare while I'm here. Okay. Or do they go back and say, well, you know, DHS, Department of Human Services, handles that, so I don't have to worry about that. So,
right. Well, DHS handles the Medicaid part. So the Social Security Administration handles the Medicare part.
Okay.
So you want to go to the Social Security Administration to talk about Medicare and your Social Security.
And you should do that within your 7-month grace period.
Right.
Okay.
Right.
Okay. You know, because
right.
I hear people saying they've been penalized, but they didn't know what they were really being penalized for. And you just clarified it and said once you're penalized for life? That's
yes,
scary.
yeah, it doesn't go away.
Okay. I thought it was a one-time charge.
Yeah, no.
You get your hand spanked because you didn't do something timely.
That's right. That's
gee.
right.
Okay.
That's amazing,
Let me
right?
check my coverage. Okay. Okay. So how do Medicare Part A and B work?
Okay, so Medicare Part A is your hospital coverage. So if you go into the hospital, when they do billing, they're the ones that's going to split it up between A and B. Because A is going to be the hospital, B is going to be the medical services. So like the doctor that did the surgery or that's caring for you, that's how they're going to split it up. So B, medical services, A, hospital services.
Now, part of that, say like you got Blue Cross Blue Shield, and then you got Medicare. Doesn't Blue Cross Blue Shield get a portion of that bill before the AB kicks in?
Well, it depends on, remember we talked about the Medicap and the Medicare Advantage? Blue Cross has both of those. So if you get on a Medicare Advantage Blue Cross, then that is your Medicare.
Okay.
It's like Blue Cross have taken over your Medicare.
Okay.
So all that A, B, and C, all of that, that's C actually. The people always ask, what's Part C? That is Part C. But if you are with Blue Cross and you have Medigap, then Medicare is billed first, Medigap pays the rest.
Okay.
Medicare pays 80%, Medigap pays 20%.
That's scary, Sharon. Okay. All right. I think I better stick to what I got. Okay, but you know, I'm going to take a look at my card and see, does it say Advantage? Because I think mine's does.
Okay.
But what's a PPO?
Now, PPO allows you to go outside of network. And what I mean by network is if you choose a plan, you want to make sure your doctor takes that plan. That means he's in network with that plan. Okay. When you have a PPO plan, it allows you to go outside of network.
Great.
You may have to pay a little bit more. Some of the carriers will say you pay this much if you stay in network, but if you want to go outside, you can, but you're going to pay this much.
Now, what I find difficult is that you can, like you go to the doctor and like I said, you got this copay, okay, but then you pay the copay and then you may still get a bill with some balance left over or whatever, and you're trying to read that bill to see who paid what, okay? But it doesn't always come out clear that you know that this was the Medicare portion and this was the insurance care portion. A lot of times, what I'm concerned about is that people pick insurances based on the trinklets, and I call it trinklets, but you know, I get food cards, I get gift cards, I get transportation, or I get a food basket, or name something else, because they give something else too, something else that they give away.
That over-the-counter, gym membership?
Yeah, stuff like that. Now, I'm not saying that that's wrong, but how does a person know they're fully getting the use of their Medicare portion of their insurance when they have all these other little things in the way? I just got this because, you know, they're going to give me a free transportation every month.
Yeah. Yeah, when you're trying to choose a company that you want to handle your Medicare, you do want to go by, you want to look at what are the copays, how much am I going to have to pay when I go into the hospital, or if I get a CT scan, how much is that going to cost? That's really more important than my over-the-counter. But you're right, some people get sidetracked with looking at the little trinkets, as you call them.
I'm looking at it like, wait a minute, I might not need transportation right now. Okay, but they say, you know, I can take you to the doctor, Uber, pick you up, and this and that.
Right.
I'm not mad at that, but I just want to know if I don't need that. And then some people get the sponsor credit cards or discount cards that they can go to certain pharmacies or stores like Target or something and use that card. And they get excited. I'm not downing any of that. I just want to make sure I'm not overspending from my own personal monies for my care when I've already paid into the system for my insurance and my Medicare coverage.
Right. And that's why you need an agent to work with you, too, so they can guide you. Because normally what I'm doing is comparing carriers for a person, and then I let them know what it covers. This is how much this is going to cost if you go into the hospital. This is how much it's going to cost if you need emergency care. A lot of people don't know if you call 911 that it's going to cost you $300. That's a copay. So we talk about that. Those are the things we talk about first before we even get to all that other stuff.
But we don't want to discourage anyone, don't call an ambulance.
Right.
Because when you call out for an ambulance, you're too sick to know that it's a bill behind there.
Right.
But do you feel as though people should call their insurance companies and ask, is ambulance service coverage in the plan, or is there such a thing?
I think they should have an agent that they work with.
Okay.
And have the agent look into that and explain it to them so they can understand it. It's hard to understand all this.
It is, and recently we had a conversation about nutritionists. So you guys also can help a person understand about having a nutritionist come to their home or going to the doctor and meeting a nutritionist. How do you know that's in your plan?
Right. See, that's what you'd have to look up. Now, the way you know what's in any plan, they do have, all the carriers have to explain what's in that plan, and that's called summary of benefits, and they also have evidence of coverage. The evidence of coverage gives you every nook and cranny of that plan. It's like 200 pages. It tells you everything that's in your plan. That's the best way to look.
Okay, and what's that called again?
Evidence of coverage.
Okay, all right. We're going to take a break on that evidence of coverage, ladies and gentlemen. I know you wrote that down. Okay, and on that note, we're going to take a break and we'll be right back.
If you store your guns properly,
I'll feel safer when I'm playing outside.
Safer when walking home.
And I won't have to tell my kids, this isn't a drill.
Never let your gun get into the wrong hands. Always lock it up.
We see champions everywhere we look. In every sport, on every court, we're building a foundation to ensure all athletes are safe, supported, and strengthened. At the U.S. Center for Safe Sport, we're shifting sport culture because every athlete deserves to compete free from abuse.
Well, welcome back, ladies and gentlemen. I don't know about you, but I'm having a great time learning more about Medicare. And Sharon Gray, as an advisor, has given us a wealth of information, so we don't want to stop there. But always remember, if you have questions, you can always give us a call at 1-800-323-5336 or email me at Marcia@JustAskTalkShow, and we will get the questions over to a person like Sharon or Sharon herself if you want to have some more information. Now, Sharon, I had to say that because our viewers, they get excited too, and they'll give us a call and say, what about that person you had on that talked about this, this, and this? So this segment in here touches a lot of us. Matter of fact, it touches a high percentage of us. I don't know what the percentage is of people turning 65 this year, but whatever it is, they're paying attention. Okay. Okay. So let me ask you, so is the employer plan a better plan to go with when a person is, getting ready to retire? Should they keep that plan that they originally had from the employer?
Not necessarily. It depends on the plan. And that's one of the services that I provide, is to compare the employer plan to what they would get in Medicare. And I've done that for people who I've looked at it and said, oh, this plan is great, you need to stay on this. Or I've looked at it and said, oh, this is bad, we need to get you off of this. So it really depends on what the employer is offering. And you can always take a look at that. I alluded to summary of benefits. I don't know if you remember that, because I'm giving so much information. But the summary of benefits details everything that's in that plan.
I'm gonna look at mine. Okay.
Summary of benefits.
Okay. Now, what about a buyout? If a person is getting ready to be offered a buyout, Okay. Should they go ahead and take the buyout and learn the hard way what the benefit package entails, or should they see an agent?
If you are considering a buyout, the first thing you're going to do is talk to your HR department, because you want to know what is being offered to you. Are you going to have health insurance, or are you not going to have health insurance? Is that included or not? And if you're 65, then you need to talk to an agent like me. And that's what I love to do, is to just help people in that situation, to just give them clarity, and take out the confusion, make it so it's not so stressful. So yeah, they need to talk to the HR department to find out what's being offered to them. And then they need to talk to an agent to have them compare the two. Like, what should I do? Should I stay on this retirement plan? Should I get off of it? And you can't answer that until you look at the summary of benefits.
That's great. I'm going to look at my summary of benefits. Okay. All right, so I want to talk about the retirement report. What is the retirement report?
That is a report that I email to all of my clients. I do workshops every month at the libraries, different libraries in Detroit. And I leave everybody with that retirement report. And then I email a more current one. I may give them an older one just so they can see what it looks like. But everybody each month gets some type of retirement report or newsletter from me. And in that newsletter, it's just talking about any changes that's coming up with Medicare. It talks about 401ks, because that's something else we got to think about, is our money when we retire. It gives recipes in there, because we might be cooking more. We're at home now. Puzzles to help with brain health. That's really important. So there's different articles in there to keep everybody updated. Okay. And that goes out.
And it's a monthly report, because I see this one says May.
That's May.
Okay. Okay. That's a good way to keep up if you're looking for one for each month.
Right. Yeah.
Great. Okay. And we have some information we're going to bring up on our screen so that we can talk about that as well. Okay. But you know what? I believe this retirement report that you have is a newsletter. People can actually get it by digital?
Yes, email.
Okay.
I always email it to them.
That's a great thing.
Yeah.
Okay. So now this display we have here on our screen, tell us a little bit about this, because I see it has 4 different major components.
Yes. I like this because it doesn't go into the A, B, C, and D, which everyone wants to know, what does that mean? It actually gives you the name for each one.
Great.
So the hospital insurance, that's the part A that you were asking about. The medical insurance is the part B, and the prescription drug plan is part D, and then Medicare Advantage plan is part C. So those are all the different components of Medicare that pretty much all that A, B, C, and D confuses people, but that's just telling you what each one stands for.
That's what it stands for. Okay. Now, do a person have to actually call to make sure that they have all those? I mean, I remember the red, white, and blue card. You don't get that anymore. So,
well, with the red, white, and blue card, you get the first 2 at the top, the hospital insurance and the medical insurance. That's your A and B.
Okay.
That is your Medicare.
Okay.
Now, what they have to do after that, they got to take a step after that, because you're also required to have the prescription drug plan, which is the Part D. And that's when they have to find where they want their Part D to be. And then the Medicare Advantage plan, that is with private insurance companies, and you have to decide if you want to get on the Medicare Advantage plan, or do you want to get on the Medicare supplement plan.
All right, so let's go to another one. So now what is this group of lovely ladies doing right here?
Yes, this is one of our workshops. I was at one of the libraries, and we were using their boardroom. And these ladies, they were all sitting around the table. You see, they're all taking notes. There's papers in front of them, because it's hard to remember all of what I'm going to. I have them sitting there for about an hour, giving them information, answering all their questions. And then by the time they leave, I always ask them for their feedback. And they always tell me that they have a better understanding.
Good.
And now they have a good idea
and
of what
everybody's
to do.
smiling, so I believe they did, okay?
Yeah, yes.
Good. And that's good. So you have a monthly workshop?
Yes, and I usually do about maybe 3 workshops a month.
Okay.
Yeah.
Okay.
Yep.
All right, so this is the Medicare annual enrollment period, the one that everybody's like, okay, what happens in October? So tell us about this.
Yes, October. Annual enrollment period, AEP. This is a very important time for anyone who has Medicare, because that is the time, the good news is whatever you chose to do with your Medicare, you don't have to keep it for life. You're able to make a change, but you have to make a change during an enrollment period.
Correct.
Or an election period. So AEP is a time, it's like open enrollment for anyone who has Medicare. So it's across the board. So this is just explaining the changes that you can make, if you want a different Part D, if you want a different Medicare Advantage, which is your Part C, or if you want to switch from Part C to Medigap, or you want to switch from Medigap to Medicare Advantage. All this switching is going on during open enrollment, and it's every year from October 15th through December the 7th.
Correct.
And then your coverage begins in January 1.
Okay. All right, that's good.
Yeah.
That's good.
Yeah.
And you know what, Sharon, I appreciate you being so clear and concise about what it is, because like I said, and this show is going to air shortly, and people will be calling or asking questions, and
Sure.
I'm like, hey, call Sharon.
Right.
Okay.
Especially during AEP.
Right, but
yeah.
you know what? You even clarified a lot for me too. Okay, you did. You clarified a lot for me too, because I'm thinking I got it, under control and everything. I'm listening to it. I'm like, I don't know if I got that right or whatever. So,
Right.
And I just want to make sure. But it's everything sounds like it's a good plan, especially if you have the classes like you do.
Yes.
And so you have classes every month.
Every month,
Okay.
yes. So if you go to my website, there's a link on there that shows you where the classes are going to be
What's
and
the
what
website?
time. Oh, grayinsuranceadvisors.com.
Okay, Gray Insurance Advisor. Okay.
Yeah,
All
when you
right.
go to that website, it'll show you where my classes are going to be.
Okay.
Yeah, and they're geared towards people who are turning 65, because those are the ones that have the most questions and have the most confusion and just don't know what to do. If you have Medicare already, then I just work with them one-on-one, because they don't need the first part, because they're already past that.
Okay.
So
But they are concerned because they want to make sure they got everything
right.
covered just the same.
Right.
Okay.
Right.
Okay.
Exactly.
Especially those, like I said earlier, about people who have sustained disabilities or whatever, and they already automatically got Medicare.
Right.
They still need to know something.
They do.
Okay.
They do. They can contact me. And for those that are about to retire, and when we talked about when to enroll for Medicare, when you're about to retire, if you know your date, let's say it's December, then you want to start this process about 3 months before you leave. You don't want to wait until that month or after you're gone. You want to start applying 3 months before.
Isn't that something?
Yeah.
I mean, you're so excited to retire, you haven't thought about it. At least I didn't. Okay.
Right.
Okay. Well, wonderful. Well, Sharon Gray, will you come back and join us again?
Of course, of course.
Thank you so
My
much.
pleasure.
You enlightened me and enlightened our viewers. So,
Oh, well, good.
Thank you so much.
Good.
Thank you.
Yes.
All right. Well, ladies and gentlemen, I don't know about you, but every time I have a guest, I always tell you I learned something, so I'm hoping you're learning something too. And like I said, you can get all our information and give Sharon a call or give us a call or email us, however, and get that monthly newspaper, okay? A news report. All right. So I'm your host, Marsha Florence Padres-Das, and what do I always say? If you have a question about a person with a disability or just a general question, don't be afraid to ask. Just ask. I'm your host. Thank you.